Hi, everyone, and welcome to another edition of the Lympha Press Educational Webinar Series. This has been on our books for quite some time, and we are so honored and excited to have Dr. Epameinondas Gousopoulos with us. And you are zooming in from where?
From Zurich, Switzerland.
And what time is it there?
7 p.m. So great to have my afternoon tea.
Wonderful. Absolutely. So wherever you are joining us from today, those of you who are logging on, we welcome you. We're so glad you're with us. Let us know in chat where you are logging on from. And as a brief introduction, you all probably already know Dr. Gousopoulos's background and his credentials, which are very impressive. A board-certified plastic surgeon located in Zurich, as he said, pursued a master's degree in medical biology with a PhD at the Swiss Federal Institute of Technology in Zurich. And his particular focus was on the pathophysiology of lymphedema and the identification of lymphatic vascular activators. Today, we are talking about anti-aging research and lymphatic skincare, discussing the role of the lymphatic system in aging, the history of the identification of the first lymphatic activators, and a new era of lymphatic skincare. So without further ado, please take it away. I will disappear, but I'll come back. Everybody, you should know this is being recorded. It will be posted on the Lympha Press website as well as on our YouTube channel. Everybody who has registered will receive a recording of the replay so that you can watch it again at your leisure. Please put your questions in the Q&A. We will address those at the end of the presentation. And now, without further ado, Dr. Gousopoulos.
Brenda, thank you very much. It's a great pleasure to present you something that is actually has never been the main projects that I was working during my PhD time and then continued after. To be very honest, the entire situation, the entire project of identifying lymphatic activators emanated from my work against lymphedema. So during my PhD time, I studied lymphedema using animal models, human tissue, and the equation that arose is, it's great to understand the pathophysiology, it's great to understand the mechanisms underlying. How about something that could be a medication to support lymphatic regrowth, lymphatic activation. And this is how everything started, giving birth to a completely different project that is related to anti-aging research, and how we identified the first lymphatic activators and the role of lymphatic vessels in skincare and anti-aging. I just need to find a way to move the slide. Yes. In terms of disclosures, I'm a part of the company IRA that has the license of this technology that has been patented, and a shareholder of it. The identification of the lymphatic activators occurred at ETH many years ago, actually, while I was doing my PhD in the lab of Professor Michael Detmar. I assume most of you might know him. He's a very well-known dermatologist, professor at ETH. He used to be professor of dermatology at Harvard University for more than 10 years. He's a person that has dedicated his life in lymphatic research, and I was honored to have a position in his lab where I pursued my PhD. After my PhD, and just to have an idea of why we took a little bit of this direction of anti-aging research, I pursued my further medical career in plastic surgery, completing my residency and being currently attending surgeon and principal investigator in the Department of Plastic Surgery of the University Hospital in Zurich. I've been working the last, I would say, 10, 11 years solely on lymphedema and lipedema, and anti-aging research emerged actually the last 5 years approximately. And these results come from ETH, where we had a great privilege, the great freedom to think freely and develop ideas further, taking us to completely new paths. Most of you are familiar with the lymphatic system in general, but beside the fact that we're talking about a network of lymphatic vessels, we should zoom in a little bit. What is the lymphatic system in the skin? under the surface of the skin, we have this very delicate network of small, fragile lymphatic vessels, transparent in nature, spanning the entire body, that they take up the fluid, transport it, and in very simple words, is in principle our natural purification system, the system that is there as a washing machine of our body, being responsible to take up all the dirt or the metabolic products, all the biological products of our skin, and bring them back to the central circulation upon filtering. And this is the image at the left of this screen, a cartoon of how our skin is supposed to look like in terms of anatomical hallmarks. The upper layer is the epidermis, moving lower to the dermis. You can see the blood vessels, veins, and arteries, and in green, the lymphatic vessels. You can see as well some of our skin accessories, hair, but this is how we depict it. And this is how you see it at the right, how the anatomy of the skin really looks like in terms of the vasculature. On the upper level, you can see the epidermis, you can see the blood vessels, that they go up to the epidermis, and you can see where exactly in green the lymphatic vessels lay. So our skin is full of lymphatic vessels, and it took us actually very long to understand the real anatomy and the real structure of the lymphatic network in our skin. And this is, in fact, the very first movie that has been ever recorded of a living lymphatic vessel pumping actively. This was recorded in the lab of Michael Detmar at ETH. And as you can appreciate, the structure is a very fine, very delicate structure. It has been neglected from science and medicine for very long due to the transparent nature of the lymphatic vessels. And you can see it here pumping. You can see the valve through which the fluid goes and supports that we don't have retrograde flow, not back flow. And this is how our system actually works. And what is supposed the lymphatic system to do in the skin? Well, more or less similar function as in the rest of the body, but still a little bit different. It is there to remove naturally all the skin waste, the skin byproducts that our normal metabolic function of the skin produces. And that means that by removing the product, we give the ability to the collagen and elastic fibers of the skin to regenerate. It inhibits inflammation and is the route through which the immune cells are actually transferred. And this enhances the skin's natural regeneration potential, because as we know, inflammation, persistent inflammation, is one of the reasons how collagen and elastic fibers degrade. And then it removes the excessive fluid from the skin, resulting in a more depuffed, more sculpted skin. So what we call a younger looking skin. And through these key functions, number 1, 2, 3, it protects against aging. Now, it is interesting to see how the lymphatic system works. And we made a cartoon with that so that you can appreciate how delicate the entire structure is. You have a normal skin producing metabolites. You can see in red and in blue the vasculature, and in this yellowish green structure are the lymphatic vessels. And this is a healthy young skin where the lymphatic vessels are still intact and they are able to transport efficiently the fluid. But as aging occurs, and aging means at the same time more UV damage, more stress, the lymphatic vessels become more holy, they become more permeable, they lose their ability to transport the fluid, which means the waste that our skin is producing is staying there, being able to enhance collagen elastic fiber degradation. That means that when our natural washing machine is not working, we lose the capacity of removing all the harmful substances that they are there, and they support the aging process and the function of the UV damage that otherwise becomes irreversible at some point. Very important identification of the lymphatic function in aging occurred a long time ago. That was pioneered as well by Professor Detmar by the time he was at Harvard University. And as part of their research, human biopsies were examined, taking biopsies from younger middle-aged and older women, and they were examined under the microscope in regards to the structure, number of the lymphatic vessels. And you can appreciate on the upper picture, the upper image, the green structures are the lymphatic vessels. So you can see that in the skin biopsy, you can clearly see the hallmarks of the skin architecture, epidermis, and hair follicles. There are still big, probably well-functioning lymphatic vessels, but as we age more, the lymphatic vessels, as we say, they become less, they become smaller, and they become fewer. And that means that the lymphatic vessels at some point die out. And you can see that in even older skin. And just to give you a little bit of the age distribution, that means something around 25, that means something around 45, that means something around 65. The lymphatic vessels almost disappear. That does not mean that they die, all of them, otherwise we would be swelling, but the fragile lymphatic capillaries clearly reduce in number and in function, and that means we lose the ability of purifying the fluids that a metabolic product that is produced in the skin, so that to slow down aging and improve skin appearance. So how actually does the lymphatic system work or loses its function during aging? The number one problem occurring during aging is what we call the rarefication of the lymphatic network, so that we have fewer lymphatic vessels being present as we grow older. That means the lymphatic endothelial cells lose their survival potential. In other words, they die out. We see a downregulation of what we call lymphatic master gene, so a key regulator of lymphatic function, and this is the gene PROX1. And this is something that has been studied, and I cite beneath the respective literature that this decreases over time as we grow older. At the same time, what it happens is we see a reduction in the VEGF signaling. And VEGF-C is one of those key cytokines essential for the development and function of the lymphatic network. And this is naturally produced through our skin. And when we grow older, the capacity of our skin to produce VEGF-C reduces, which means, respectively, the survival and function of the lymphatic vessels is reduced. We see a decreased pumping activity of the lymphatic vessels, which means the lymphatic vessels that they are still there, they are losing over time their capacity to function, to push away and transfer the fluid with all the immune cells and the waste from the skin towards back the central circulation, where the entire filtering and return to the circulation occurs. And they become more leaky. So the waste that is attempted to be transferred leaks out in the interstitial tissue. And that means the parameters, the substances that they are responsible for the degradation of collagen and elastic fibers remain in this tissue, and they further harm these essential structures of the skin, leading to skin that is more saggy, leading to wrinkles, leading to a more aged skin. What are the mechanisms underlying lymphatic aging? And this is exactly what I mentioned before, and I would like to go down a little bit more towards specific genes, and these are unpublished results from our work, where we conducted genetic analysis, transcriptomic analysis of more than 19,000 human genes in age versus a younger human gene. And this refers to the isolated lymphatic endothelial cells. So in principle, you're able to take the lymphatic endothelial cells, culture them, and see what happens over aging of the lymphatic endothelial cells. And what we see is exactly that. Survival factors as PROX1 and podoplanine are reduced. We see a significant reduction of VEGF-C, as well as the co-receptor neuropilin-2, another receptor that collaborates with VEGF-C. We see a significant reduction of another gene that is called ghrelin, essential for lymphatic vessel function and responsible for the communication between the lymphatic endothelial cells and the smooth muscle cells. And then we see a significant reduction in the hyaluronic acid receptor, an essential part of the lymphatic vessels, a gene called LYMPH1, and the integrins alpha-1 and alpha-2 that are essential for the anchoring of the lymphatic vessels with the neighboring collagen fibers, which supports the function of the lymphatic vessels. So we know now what the problem is. During aging, we're not aging simply as a wall, but we have to see the clear determinants of the skin aging. And an essential one is the lymphatic vascular problematic that arises through the rarefication and decrease of the function of the lymphatic system. So as I said before, the attempt originally was not to develop something that is aiming to reverse aging or improve aging, but the project was to identify a new lymphatic vascular activator so that we are able to treat other diseases, such as lymphedema or conditions where the lymphatic system is damaged or the function is reduced. And that was indeed successful. Something all of it has been licensed to a pharma company with the aim to develop a drug, but there were other products that they were not capable of being used for medicinal purposes as a drug. What was the concept and how we did it? We had access to the University of Basel and through a collaboration, a professor that spent his entire lifetime collecting plants all over the world and making extracts out of them and studying the botanical properties. So he made a library of more than 2,200 plant extracts that we were able to take and test in a very delicate in vitro system. So what we do is we take lymphatic endothelial cells, human lymphatic endothelial cells, and we coat this kind of beads, as you can see here, with them. Those are embedded in well plates with collagen, a structure that mimics a little bit the skin architecture. Of course, very primitive way to imitate it, but it's the best way that you have in an in vitro system to test the capacity of specific substances to activate the lymphatic endothelial cells. And it's actually the most accurate one that exists to date. When we culture them with different substances, we evaluate the effectiveness, the activation of the lymphatic system through the sprouting of the lymphatic endothelial cells. And the sprouting means these tentacles that you can see here on the beads, how the lymphatic endothelial cells move away from the bead and they form protrusions towards the collagen matrix within which they are embedded. This is a way to imitate lymphangiogenesis that occurs naturally in embryonic stages during our development. And this is an extremely sensitive test to validate the activation of the lymphatic endothelial cells. And we found indeed 5 additional plant extracts that they were able to activate the lymphatic system. All of them in different capacities. So we spent 1.5 to 2 more years trying to figure out the right concentration, the right dosage of all those substances together. And we found a mix that is able to activate almost by 300% the lymphatic function. So we had in our hands for the first time a mix of natural plant extracts, a blend that was able to really extremely boost lymphatic function. And this is how it looks when you see them under the microscope, how the tentacles form and the lymphatic endothelial cells protrude. And to the best of my knowledge, this is actually the first patented lymphatic activator besides the substance that has been patented for medicinal development that is able to activate the lymphatic system. So as it is not possible to use them for medicinal purposes due to the properties of the natural plant extracts, given Michael Detmar's expertise as a dermatologist, as a person that co-developed in the past skincare lines with international skincare companies, and my direction towards plastic surgery and anti-aging research, the idea was to repurpose our findings and use them as an anti-aging blend. We validated our findings and we validated the mechanism of action as well by using skin biopsies coming from the surgery. So when we perform surgeries where we excise the skin, We took out of these remnants skin biopsies, we cultured them with our lymphatic complex. We did stainings, we did RNA sequencing. We wanted to evaluate what happens to the lymphatic vessels and to the genes that they are regulating the lymphatic system. We cultured them in wells for 24 and 48 hours, and this is what we found. Under normal circumstances, when you culture the skin and you then make sections out of it to study the structure of the lymphatic vessels, you can see here the lymphatic vessels as collapsed structures in the skin. This is the control situation just with the normal medium. Then we added wells where we had VGFC, our natural lymphatic vascular activator, so the one that our own body produces. And then we have the one with the lymphatic complex, these 5 plants, natural plant extracts that we had identified. And as you can appreciate, the lymphatic vessels look clearly happier. They are not collapsed. We can see the lumen. We can see that they are bigger, which indicates the activation of the lymphatic vessels. And this is exactly what we achieved. And then we validated through RNA sequencing. How does it actually work? So in principle, we're able to reverse one by one all the parameters that they are damaged through aging. We support survival gene activation, and we're able to prevent the erification of the lymphatic vessels by activating the 2 master genes, podoplanin and PROX1. We are able to support the lymphatic maintenance, and here we need to separate the 2 items. Survival is different than maintenance, and for that, responsible is the gene railing, a gene that is related to the communication between the smooth muscle cells and the endothelial cells, and plays an important role in the pumping function and lymphatic morphology. Additionally, we see activation of certain receptors and that they play a very important role in the lymphatic vessel function, namely neuropilin-1, LYMPH1, and the integrins. And these are genes that we clearly see being reduced during aging, and genes that they are related to inflammation, increased leakage of fluids out of the lymphatic vessels, and the integrins are structural components anchoring the lymphatic vessels to the collagen and elastic fibers and supports lymphatic drainage. So we are able to support, to boost receptor gene activation that is essential in the process of lymphatic aging. And this is a very simple cartoon where you can see very, very schematically how normally our skin is and how under normal conditions, healthy young skin, epidermis, dermis is on the upper level and produces all this waste, and this is normally transferred through the lymphatic vessels. During aging and UV damage, we see the permeability of the lymphatic vessels and function of the lymphatic vessels being damaged with the leakage of water and downregulation of all the survival factors, maintenance factors, increased inflammation, breakdown of collagen elastic fibers, and then the application of the lymphatic complex that is able to restore the lymphatic vessel function, protects against leak, boosts up the survival factors, and in that sense acts in an anti-inflammatory way, supporting healthy collagen elastic fiber maintenance and regeneration. And this gave birth to IRA, the company that licensed the technology that we produced at ETH. And IRA might not mean something to you as a name, and it's an artificial name, but it comes from the 2 words I-ray, I radiate. Because at the end of the day, what is radiance in scientific terms? Radiance is our capacity, the capacity of the skin to reflect the light correctly. That's how you glow. And during aging, when you lose the structure of the collagen, the elastic fibers, when you are more puffy, you're not able to reflect the light correctly. Imagine very nicely, if you're familiar with any plastic surgery procedures, when we are talking about rhinoplasty, nose job, what people easily think is how shiny the tip of the nose is in a nice image after a rhinoplasty. And this is an indication of how the reflection of the light plays a role in the way our face appears. And this is exactly the same with radiance. If the skin structure is improved, if the collagen, the elastic fibers have the orientation and the structure they had when we were younger, when we are deprived from puffiness, excessive fluid, then our skin glows, then our skin looks happy. And this is the function of the lymphatic complex of natural plant extract that is able to support lymphatic vascular function, to purify the skin, providing a more sculpted looking appearance, to boost skin health because we create a different skin microenvironment. We enhance lymphatic activity that boosts microcirculation, improves the cell turnover, supports with hydration, nutrient uptake, and that's how, at the end of the day, our skin looks healthier and more radiant. And of course, protects against inflammation, supporting the drainage function of the skin, enhances the lymphatic performance, and in that sense, the breakdown of elastic fibers and collagen fibers is reduced. I would not say slowing down aging process, but being able to restore a part of our function of the lymphatic function of the skin as well. It's not supposed to be a products show. I just wanted to understand you to understand what that means and what that implies. And currently, the product portfolio that is used not only as just skincare, but as a topical activator of the lymphatic vessels without medicinal implications, includes 3 products that are already in the market, and the 4th one, the body cream, that is actually coming in 2-3 weeks from now. And why this importance? Because at the end of the day, I am a scientist and a clinician, and the most important aspect is the clinical results. And this is what I think is the most important take-home message when we're talking about anti-aging and activation of the lymphatic system. What does it really mean about our skin's appearance? And well, a lot of things work in the lab, but this is exactly the problem of translational research when you try to do something in the lab, but you apply it in the human situation and then it simply doesn't work. But the lymphatic complex works. And you can appreciate here the eyelids of an older gentleman, used to be 66 at the time that we took the picture, who applied the product with the lymphatic complex, and you can see the results within 6 days. What is the result? Clear anti-puffiness effects. And why is that? The area around our eyes, medically called the periorbital area, is the richest area of lymphatic vessels in our face. And by activating the lymphatic vessels, you drain all the excessive fluids that you have in the periorbital area. And this is something that you can clearly notice in the morning when you wake up. And the simple reason for that is during the nights, our lymphatic function is reduced. Lymphatics work through pumping, and pumping is supported by the action of the muscles. And so, of course, during the night, we are resting. There is minimum muscle tone, which means that the lymphatic vessels work to the minimum. And this is how we accumulate fluid in the periorbital area. And these are the results that you can obtain already within 6 days upon application of such a product with the lymphatic complex. And then we go a little bit deeper into the skin care and the anti-aging effects. At your left, you can see a face before the application of the products, and on the right, after the application. What you can appreciate at the right is that the face generally looks less heavy and more contoured. This is exactly the result of lymphatic vascular activation, removing excessive fluids, and then with all the other ingredients that they are included, improving fine lines, removing signs of inflammation, the redness that you can see that we clearly have a lot of us around the cheeks. Improving lymphatic functions means you more efficiently transfer immune cells, you support the reduction of inflammation and redness, and of course, the sculpting effect that comes through the entire activation of the lymphatic network. Another example of how much more improved the skin texture is after the application of products including the lymphatic complex, with improvements of the signs of aging, particularly for women around the jawline, around the cheeks, better definition of the hallmarks of a face that is younger. So the cheekbones are more defined, the jawline is more defined, wrinkles are improved, and this happens already within 8 weeks. The skin complexion is visibly brighter, skin redness is reduced. Another example of very dedicated activation of the lymphatic vessels around the eye, and you can see that within already a period of 8 weeks, we are able to see almost 50% reduction in the crow's feet, in the wrinkles, fine lines around the eye. And here, this is a clinical study conducted using the Visio machine. It's a device that is in principle able to quantify, give you numbers based on the before and after images, taking images of the skin from standardized angles and depicting the hollows and the ridges. And this is how you define the wrinkles. You can see the significant reduction after just 8 weeks of application. And this is a selection of different user actually material that came to us, where you can see that the application of the products improves the skin complexion, improves this puffiness, results in a much more sculpted face. And as a matter of fact, the first signs of aging appear at the lower parts of the face, the jawline, which you can see here how much more well contoured it appears, well, way more defined. The face appears in general less heavy, more sculpted. Inflammation and redness is reduced. And this is exactly the result of the lymphatic activation. Lymphatic activation has for a very long time just been considered something that happens but probably doesn't have a clear effects in the way that we age and the way that we grow older, but actually is a cornerstone in the aging process. And you can see the clear difference in the results we're able to obtain by activating the lymphatic system. Of course, one would claim, yes, I can do it with lymphatic massage as well. Definitely, this is something that one can do. But I don't think it's very easy to be able to have a facialist next to us every day and apply a facial every day so that we're able to activate our lymphatic system. And our lymphatic system, when it's activated through a facial massage, which is fantastic, or a body massage, equivalently for the body, the activity, the boosting is maintained short term. And medicinal products, which is not what IRA is, would be able to boost it larger for a longer time. And in this case, the natural plant activators included in the skincare formulation are able to deliver this sustainable activation of the lymphatic vessels. And here is an example of the shaping body cream, the product that is going to come to the markets within a couple of weeks. And you can see exactly the sculpting activity of the product. In the more bright blue, you can see the structure before, and the silhouette with the darker one is after just 4 weeks of usage. And you can see the improved contouring that you're able to achieve by activating the lymphatic system through the lymphatic complex. And this is applied without any special massage. Of course, applying any type of skincare along with a massage technique that is able to additionally support the lymphatic vascular activation is most welcome. Why this importance in anti-aging in general? And that's where a little bit prevention meets regeneration. And there is a number of items that is actually taking place, a lot of treatments that we undertake, and I can see it from both sides, from the plastic surgery perspective and somebody interested in skincare. And the implication of the lymphatic vessel in processes where we probably did not consider that it plays a role. And the most important parameter for the most important action of the lymphatic system in all those different processes that we undertake, surgeries or minimal invasive treatments, is actually that we are able to reduce downtime, so the recovery time after this process. And I can give you a very good number of examples. Botulinum toxin, Botox. Who doesn't know Botox and who doesn't use Botox? Well, don't tell me. But what you do by using Botox is you paralyze the muscles so that you avoid the dynamic wrinkles of your face. By paralyzing muscles, you're in principle paralyzing the driving force of your lymphatic system. They are not functioning anymore in the same way. So you're able to drain the fluids from the skin less. That leads respectively, particularly to people aging more than 55, where you already have some signs of aging, to a certain degree of puffiness, particularly around the eyes, after performing Botox. And lymphatic skincare is there to support the lymphatic activation. Fillers, another very good example of aesthetic treatments that we use as we grow older. The aim is to restore the volume. The aim is to have a more youthful appearance. But at the same time, by the time you start with this kind of injections, eminent effects the first couple of days is inflammation. There is some low-level inflammation that occurs. There is additional maintenance of fluids in the area, which in principle shows less the aesthetic results of what you have been aiming to achieve. And by activating the lymphatic system, you're able to improve the inflammation that the filler is inducing, and you're in that way improving the final effects of your application. Other treatments that people are using even at home, microneedling. We do it in order to create a small wound into the skin. That's the natural process of wound healing. And through this natural wound healing, we support collagen elastic fiber regeneration. But at the same time, we generate a certain degree of skin inflammation, which is again resolved only through the lymphatic system.
So I'm going to interject here for a moment. Dr. Gousopoulos, I have immense respect for you and the work you do and your background. And we had specifically said that we did not want this to be a product-focused presentation. We have lymphedema therapists in our audience who are concerned with caring for their patients and best practices with regard to skincare. Aesthetics are not the top priority for our audience. And I was hoping that perhaps we could pivot to more of a general discussion about lymphatic skincare and best practices. And I hope you don't think I'm being rude interrupting you. It's just that I feel that I may have misrepresented to our audience what our content was going to be about today, because you and I had discussed that we didn't want it to be product focused.
I'm trying to illustrate that in a number of procedures that's everybody's undertaking, the lymphatic system plays an eminent role. And by activating the lymphatic system, which is in the current case only either through massage or the first lymphatic activators, we're able to improve the function and appearance of the skin. This is at the same time not a medicinal product. That's the reason I have to refrain from wording that is dedicated to lymphedema, because that would cross the border of what our research has been doing so far.
Okay. Well, I thank you. And I ask you to continue, but if we can sort of refrain from promoting this specific product in any way, I think I would feel more comfortable with.
I think that I can make the presentation. I just wanted to illustrate that other treatments that we usually perform, such as lasers or aesthetic surgery, have exactly the same effects, where the lymphatic system is traumatized in certain aspects, particularly after surgery, and that's where the lymphatic activation plays a role. And in that case, I keep it a bit shorter so that it does not feel that is going over the border. And of course, there are implications for lymphedema patients as well. But as said, the decision to use any type of skincare, regardless of what type of skincare, comes as a recommendation from dermatologists, plastic surgeons, physiotherapists, based on personal experience, and none of the skincare products has a medicinal function, because that's a definition of skincare as well in general.
Yeah, it is. So we do have some questions that are coming in from our audience, and we do appreciate you outlining this for us. You can probably stop sharing your screen. And I actually have a few questions as well. I mean, I could talk to you all day long about the aesthetics because you're talking my language, but I want to meet the needs of our audience here. And in general, you know, I love what you were saying about how the lymphatic system eliminates the toxic waste, reduces inflammation, and does protect against aging. What are some other best practices for skincare? For instance, would you recommend sauna?
That's actually a very interesting question. And sauna in general, I would not say that it has a positive effect. At least I'm not aware of any studies being able to show that sauna per se has a positive effect. But what is arising now, and there are neither studies in that regard at the current stage, but a lot of people, and I have experienced that with people, that they have vascular problems in general. They use infrared saunas. And this is something
Which
that
is
is new,
different than a regular sauna.
which is different than a regular sauna. It's in principle just infrared light. And there are supposed to be specific implications in the way that it might interfere or support certain function of our vessels, particularly regeneration potential, but these are still anecdotal reports and there are no studies. Other applications that they are well applicable, of course, is self-care and the self-massage. Even if we don't do it as a professional, it supports a lot the way that our lymphatic vessel network maintains its function throughout the day. And this is something that can be simply done during the shower, or if we dedicate some time using a product as a part of the self-care. Nutrition is an important aspect. Nutrition relates directly to inflammation. And we can see it even from patient groups. And I'm referring here a little bit more in particular where that has been actually studied, are lymphedema patients, where the keto diet and Mediterranean diets are particularly supposed to have antioxidant effects and support in that way the anti-inflammatory function of the lymphatic vessels. There are a few nutrients like blueberries, certain nuts, that they are supposed to have substances that they are able to promote lymphatic function as well. But I think, unfortunately, to that date, very little research has been done in regard to how nutrition is specifically able to address lymphatic function improvement. And it's actually rather complicated. It has a lot of difficulties because the models that this is applicable to use and study the function is only animal models, and this is not translatable one-to-one to what happens with us as humans. Mm-hmm. And of course, invasive studies where you're able to study the effect of a diet in humans are extremely difficult to find an ethical basis to be performed. So it's way more difficult to clearly claim that certain nutrients have a direct effect. Is usually more into the context of broader studies and evaluating well-being, quality of life in dedicated patient groups or age groups.
Mm-hmm. So I know you're an expert in both lipedema and lymphedema. Are there different things with regard to the skin that therapists and patients should be looking for? And are there different approaches to treating skincare for lipedema and lymphedema?
I would say there is a very common confusion about the fact that what lipedema and lymphedema is, and a lot of people think that, yes, I have lipedema, but I have lymphedema. And my research the last 5 years, and we published recently a paper about it, is that lymphedema and lipedema are, or let's put it like that, secondary lymphedema and lipedema are two completely different entities. And there is no evidence, no supporting information that they are anything similar. They are clearly different. That said, the pathology underlying the conditions is different, and that reflects differently in how the skin appears. The skin of lipedema patients is more sensitive, is usually thinner, is softer. Depends, of course, a lot about the stage of lipedema we're talking about. Different lipedema stage 1 than lipedema stage 3 or 4. And of course, lipedema stage 4 is a lipolymphedema, is a stage of lipedema that already harms the lymphatic vessels. So we are talking about a combined situation. But the lipedema skin does not suffer under a damaged lymphatic network. Whereas lymphedema skin, you have a clear underlying pathology where the lymphatic capillaries are damaged. And the lymphatic capillaries are damaged way earlier than we think. The damages of the lymphatic vessels in lymphedema patients occurs already at the very, very beginning of lymphedema. The lymphatic capillaries are extremely sensitive, are extremely fragile, and therefore they are the first ones actually to show the signs of this excessive swelling that appears and might at the very beginning not be clinically you cannot clearly identify it or you cannot clearly sense it, but it's already happening. At the beginning, they are dilating, so they are not working exactly as they should. And of course, as the time goes by and lymphedema progresses, the lymphatic vessels become more fibrotic. And then, of course, the situation after a certain stage is irreversible. So lymphatic activation at the early stages in patients with lymphedema would improve skin quality, would be able to support the flow of these very fragile capillaries that they are on the most outest parts of the dermis, close to the epidermis, and in that case, improve skin quality. You are at the same time improving the inflammation, the dryness of the skin. We are talking about the skin that has a lot of swelling, water, but at the same time is dry because of the inflammation that appears, and the skin is losing its function over the time. And the earlier that you're able to identify the signs of this lymphatic malfunction, even if we are talking about barely clinically detectable lymphedema, the only person that could do it is probably a regular physiotherapist that sees the patients early enough as part of the post-surgical guidance. Unfortunately, rarely those patients are identified at a very early stage through a doctor, mostly because they don't go probably for a check to a physician for that, or there is still a low level of awareness about what you're able to do about such a condition. So I think primarily the people that they have the sense to identify the problem and see it early enough are probably rather the physiotherapists and skin specialists, where the patients go to address their skin concerns because things change after the surgery they had or radiotherapy.
So absolutely agreed. Early intervention is so important. Early diagnose is so important. By the time it presents, thankfully, it's not too late because there are things that you can do. What are some of the common mistakes that are made by patients and therapists in treating the skin?
I would say the first mistake that a lot of people are doing is not treating the skin. Not thinking of it as something that has to be treated and delay the treatment. So I think the worst and the greatest obstacle to overcome is the delay in identifying the need to take action. Number two is make sure that you always care of your skin, of the affected extremities, exactly the same way, if not more, as you care for the skin of your face. You think always you're looking in front of the mirror and this is my face and this is how it should look like. But the skin of our body is way more than of that of our face and is equally important. And hydration is extremely important. Sunscreen is extremely important. And these are exactly the factors that they influence the way that the skin behaves, even in such conditions where you don't think that this is of paramount importance, but at the end of the day, the health of the skin is the one that improves quality of life as well.
That's so good. Thank you for explaining that. Of course, we know that skin is our largest organ. It is pervious. So we've got to be careful about the ingredients of whatever we are putting on our skin. Are there warning signs, no-nos? When you look at ingredients, what should we not be putting on our skin, especially for lymphedema patients and lipedema patients?
I would say that lipedema patients, lymphedema patients, and customers that they just use skincare, they have the same don't touch list. Paraben-free, phthalate-free. I would advise against the hard retinols, because this is something that can irritate the skin, particularly when in contact with sunlight. No substances that they would increase inflammation, of course. All those parameters that they would counterbalance what actually skincare is supposed to be doing. One more for lymphedema patients is to use substances that they don't only care, and we can rephrase. I can rephrase. Say we're thinking about lymphedema patients as only the lymphatic vessels is a problem, but no, we forget that lymphedema patients have another problem as well that arises from the defective lymphatic system, and this is a defective blood vasculature where the blood vessels become leaky as well. So substances that improve lymphatic function are one thing, but substances that are able to improve blood vascular function, in particular microcirculation, are extremely important. A very good example of a very good ingredient is horse chestnut that is supporting microcirculation. Caffeine is another substance that improves microcirculation. Actually, traditional skincare, including specific diseases in Latin America, where they had the coffee beans, included even way earlier the remnants of coffee to support microcirculation in different conditions. This is how skincare actually naturally developed, identifying extracts, substances from nature that are usually directly used, that first and foremost reduce inflammation, because this is what you visibly saw by that time. The redness that you have in your skin when you're sun exposed or very dry. And then as research developed and evolved, more substances were identified that they target more specific functions.
So we're hearing in chat, coffee is amazing. I also have a comment from Ted B. Thank you for being with us, Ted B. He avoids petroleum products like the plague.
Yeah, I mean, I would understand that. I do exactly the same. No paraffins, definitely.
Okay.
But that's generally for every skin type. The only thing that one needs to consider when we're talking about a skin that has certain limitations through the underlying disease, you need to prioritize what is important. What is the most important thing that you need? And if we go very specifically to lymphedema skin, and I specifically refrain of adding lipedema into the game because, as I said, their lymphatic pathology underlying is not there, not manifested so far. But for lymphedema patients, what is the greatest problem? And is enough hydration and anti-inflammatory activity. And there are a lot of plant extracts that they have anti-inflammatory activity. Very simple chamomile, very simple rosemary oils, very simple, how it's called, just slips my mind, extracts that they are used in various skincare products, particularly those nourishing oils that they need to be used for skin that is suffering under conditions such as lymphedema.
Someone just put in chat cypress.
No, cypress is not.
No. Okay. Well, and I think one other thing as we're running out of time here is to underscore that there are some general guidelines, but listen to your body and look for how your particular body and your skin reacts, because every body is different. You may have a sensitivity to something that works wonders for someone else. Would you say that that's a good rule of thumb, Dr. Gousopoulos?
Listen to your body is always the most important aspects. Our skin, as we are not the same with the rest in the same room, we have different needs, and our skin has different needs as well. A product that works for you might not work for me. depending on how your skin behaves, the hydration level, metabolic activity of the skin, you clearly have different needs, and you need to adjust what you use to treat your skin based on your needs, and then based on your age, and then based on your activities. Because if you're a very sporty person and you like jogging out and you're like taking your exercises in the free air instead of a gym, then you're way more sun exposed. And then I would say the number one thing that you have to consider is sunscreen, not only for your face, but for your body as well, the parts of your body that they are affected. Melanoma is an important problem. And we know that lymphedema patients have a certain tendency to develop tumors in the affected extremities. I don't think, to my knowledge so far, that melanoma is one of those, but skin care, in the sense of protecting your skin using sunscreen, is a very effective treatment and prevention of a lot of things.
I have one other question before we close, because we know, especially in the hot summer months for lymphedema patients and lipedema patients, it can sometimes be difficult to use their compression garments. It's already hot, and now I'm putting a compression garment on. Is there a benefit to putting a barrier, a skin cream, between the skin and the compression garment?
You can do it. You have two side effects. On the one side is the products might be partially absorbed by the compression stockings that you're using. The other one is to what extent you feel comfortable with sweating and then having a product on your skin that might interfere. The problem is that while you're sweating, you're not reacting properly to the different substances. Under normal conditions, using one product, whatever product, you might just very well accept it when your skin is not exposed to the additional pressure of the garments. But when you have the garments on top and you're able to have, if you're able to have a product, it's great. A lot of my patients don't have a positive experience with that. The exception might be if somebody is able and willing to take down this path, dry oils. Dry oils that they
Really?
nourish the skin. They don't offer the greatest hydration as the wet oils, to put it like that. But dry oils are an option that can support this friction that you develop during summer with the garments, with the temperatures.
Wow, very interesting. For people who have follow-up questions, particularly about the product you mentioned, or who just want to reach out to you, how can people find you, Dr. Gousopoulos?
You can find me, you can write to me directly in email, you can find me over Instagram, you can find me over Facebook, whatever is easier for you.
I found you on LinkedIn, so there
Or
you
LinkedIn,
go.
yes.
There you go.
The professional channel, true.
Do you have any closing words for our audience today?
I would say, don't underestimate the importance of your body skin. Don't underestimate what care you need to offer, because people are commonly focusing on the face, and this is something that I see in the function of plastic surgeon. But as a plastic surgeon, I'm working almost 50% just doing research. And I see from my research perspective how important the different parts of our skin are. Facial skin, body skin, they are the same but different, and we cannot just care only for one part of it.
I thank you so much. Thank you for the research you've done. Thank you for your genuine care for your patients and for discovering new ways to take care of the skin. I appreciate your time today, Dr. Gousopoulos. And may all be well in Zurich. I'm in California, wherever our folks are that have logged on. If we can help you in any way with LymphaPress, please visit our website, lymphapress.com, and also reach out to Dr. Gousopoulos on any of his social platforms. We appreciate you. We wish you all good health and have a great day. Thank you.
Thank you.